Cardiovascular disease is the #1 source of death here in the United States, accounting for 1 in 3 deaths each year. According to the Centers for Disease Control and Prevention, African American men, particularly in southeastern states, are at the highest risk of developing heart disease. A reported 40% of African American men have high blood pressure, a contributing factor to heart disease and stroke. Heart disease is also a leading high-risk condition for Hispanics and whites, while ranking lower on the list for Asians, Native Americans, and Pacific Islanders. But there are ways to stack the deck in your favor. Regular exercise can strengthen the heart, even something as casual as a 15-minute walk 3 times a week. A heart-healthy diet goes a long way. Fruits, vegetables, and lean meats will keep those arteries clean. If you're a smoker, quitting will reduce your chances of heart disease dramatically as well. But even if you do everything right, you should still get regular exams with the doctor. Dr. Fred Wittenstein of Florida Hospital Waterman's Center for Medical Imaging tells us about the breakthroughs in cardiology evaluations.
CT scanning's become a go-to for cardiology evaluation, especially in patients that the type of problem they're having is questionable. If you're not sure if it's a cardiac issue, rather than waiting 24 or 48 hours for blood tests to come back or taking them to the cath lab, which is a more invasive test, we can screen them with a CT scanner now and get an answer in a matter of minutes to an hour, as opposed to waiting 2 days. We think of CT scanners in terms of slices. So a CT scanner was 1 slice, and then it doubled to 2, and so on, 16, 32. Our fastest, biggest CT scanner right now is 64 slice, and this one's the equivalent of 128 slices. And so it has a much wider range that it can scan a patient at one time, and it can freeze things that are moving. So we can freeze a beating heart now. It just allows for better, quicker, and safer diagnosis, more accurate diagnosis. The more you can see, the more you can manipulate the images, the better the diagnosis you can get for the patient. Faster is better for a lot of reasons. First of all, when we can do them quicker, we don't get motion artifact. The patients who are usually in pain don't have to be in a scanner a long time. In general, in medical imaging, faster is always better. Overall, this machine is a good choice for our patient population because we can scan people quicker, which is more acceptable to them. They can tolerate it better. We can use lower dose, which is safer for everyone, especially the pediatric patients and the patients that need repetitive scans. One of our largest customers in the hospital is our emergency room, and it's a very busy emergency room, and we get a fair amount of trauma patients coming in. And trauma patients, especially if they're unconscious and they can't tell you where it hurts, need to be scanned almost from head to toe. And so we can put a patient in the scanner and scan the head, neck, chest, abdomen, pelvis very quickly, process the images very fast, and get them to the radiologist to diagnose what's going on. Patients that need to have scans repeatedly, such as oncology patients or patients that have chronic diseases or multiple kidney stones, are much better off with this kind of scanner because it's a lower dose. And so radiation doses can be cumulative, so the more you get over time, the more potential issues you could have. And so by keeping the dose as low as possible and still get a good diagnosis, it's much safer for the patient.
For more information on the board-certified radiologist at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Imaging the Heart story link icon on our homepage at yourhometownhealth.com.